you said there's a special name for the packaged removables.
Prefab.
Prefab.
And most of the time when you put this splint on, the patient will be laying down. I'm going to have you lay down right there.
On this side?
Yep, right there.
Supine up front.
Supine, please. With your right arm right here, pen over there. Perfect.
So in a hospital, will we ever use plastic for splints?
Yes, yes. At Kaiser, we are big in plaster splints. Okay?
Is where you're lying down and having a bunch of people film me.
It's like a Friday night for you.
All right. I told you that in confidence, right?
That's a co-op.
Sugar tongs.
This is sugar tong. It's like tongs for salad tongs. That's where it came from. This one here is going to be for both bone forearm fractures. That's radius and ulna. Isolated, whether it be the ulna or the radius. Most common is going to be for a distal radius fracture, which are wrist fractures, which are a dime a dozen. We do them all day long. So probably be for acute injuries. Not too many times do you do removable versions of this. Do you?
No, hardly ever, unless they're inmates.
But they are, it's a very comfortable splint to have, and it beats doing some of the other stuff. So you can hold that for me. We'll do this, this, and this. And this. And then on Tuesday, I'll show you a removable version of this. So again, most of the time, they could be laying down. They could be sitting up on the bed too. I like to scoot their shoulders a little bit towards me. Have their arm at about a 90-degree angle. Nothing's changing except for the fact that you're including the elbow.
Use a 3-inch?
Yeah, I'm going to roll it.
Are you going to roll it?
I'm going to use a roll and unroll it. So far, you guys see me do this a million times already, right? Piece of cake.
This is like a bowler wrap.
Just like a bowler splint, except I'm going to go right above the elbow. The splint's going to go all the way around and back on up. A few areas to really pay attention to anytime you're doing a cast or a splint are bony prominences. What's a bony prominence?
The olecranon.
Olecranon's one. What about the radial ulnar styloids? Are ones as well. I haven't been talking too much about it because it's a splint and it requires a lot of padding anyhow. But when you do a cast, it doesn't require a lot of padding. You'll hear me bring that up quite a bit. Almost perfect.
Should you pay attention to the epicondyle at all?
No, not so much. But definitely the olecranon on this one. Some of the things that you guys tend to do is to get this 90-degree bend, you end up making it too thick in the antecubital space. Don't do that. Got it?
How many layers would you say in the
That's why it's not unusual, especially when you're rolling a cast, is to do this, what I was doing, so that you don't, to do this, you have to go around in the antecubital space about 4 or 5 times. So don't do that. I took a roll of plaster, same stuff I'd make a cast with, and I measure it with that.
Mid-palmar crease.
Mid-palmar crease. Make sure you make this longer than it needs to be. So I got, what, 3 layers with this, right? Yeah, this is messy.
I had to wash my scrubs anyway.
I'm not causing a mess on you. So it's just in the air. That's 6 layers. Right? What's it got to be?
8.
8 to 10. So I'm just going to do 8. Okay there?
Yep. I'm alright.
I do this to my patients too.
Roll up on our body.
No way.
To see who the cool patients are.
Get them all dirty. Laughter dust.
You'll see, I treat my patients a lot like I treat you guys. One large, one small. Come up here, mark my proximal border, mid-palmar crease, I'm digging it. I come down, I'm also cheating up a little bit on the elbow. I'm not going just straight around. I cheat up just a little bit. You don't have to do this, but I like to. Oh, I'm a little long. Damn.
Have to fold it there?
Sometimes, if I'm working on a child, I'm having issues.
Kevin, where you at?
You did the same cut as a bowler.
I'm sorry, I'm just so messing with you.
Relax.
Same cut as a bowler.
Same cut as a bowler. You can come over here and take a peek. I got plenty of time.
Just want to confirm. Go with a larger gauze on this one. Or
Ace wrap?
Ace wrap.
It's the same as I was using, I think.
Well, yeah, but in the first couple spots we were using a smaller one.
The biggest problem that you guys are going to have with this particular splint is it's going to fall off. And you're going to get wrinkles right down here. You're going to have this big, I call it gaposis. You get a big giant gap down in there. Remember, you want 90 degrees at the elbow. Relax. Slight pronation. No radial ulnar deviation. Nice 60s handshake to get in there.
There's no dorsiflexion?
There is dorsiflexion. There's about 15 degrees right there. Relax. I want to feel the weight. Huh?
Why do you cheat it on the elbow?
Cheat it.
Move it in.
Oh, move it up?
Yeah.
I'll explain as it's,
You mean behind the electron?
yes.
Yeah.
Because it's a little more comfortable for patients.
Well, the more I bring it this way, the more of an area that there's no plaster touching the skin. It's kind of hanging over the edge.
That
Well,
creates
like-
kinks?
Well, you tend to get wrinkles in there.
Ulnar nerve lives right there.
Yes.
A lot of times if it wrinkles or you got too much, then you kind of want to fold it over, and it creates pressure on the ulnar nerve, and then they are going numb in their hands, and you're changing it. It's good to do it a little bit higher.
We'll go over it. Relax. Man, you're just like a woman. Well, relax.
And now that's on film.
Hey, you're gonna put that on Facebook, right?
We do this splint. We do this in set bones with this splint quite often, especially wrist fractures. So this is like a big time splint that we do in the emergency room.
And you said you hardly do it removable.
You don't do too many of them removable. Most of them are acute, meaning right away. Any questions so far?
Most of these are just off by the next day for.
Couple days up to a week.
Okay.
Sometimes I can, if we set the bone with it in a splint, sometimes you can actually wrap a cast right over the splint, and you don't even need to take the splint off. I used to be a huge fan of that. I still am a fan of that. I actually think it's a good idea. The casts are ugly as hell. They're big and bulky. I think there's technique behind how to do that, how to make a splint into a cast. But again, you know, I've seen so many things just look horrible.
Is that just so you don't, you're kind of keeping everything
Well, you got to worry about how you're going to cut it off
Okay.
whenever you have a cast on. So what you're talking about, what we're talking about right here, I'm going to bring your arm up. See this? If I bring this over here, a 5 by 30 or a 4 by 15, just something small. I got one right here. I got one right here. If I do this, you see what I'm saying? Even if you think you got it, and you know, how do you make those wrinkles go away? You know, it's hard. I can do it, whichever way, but you know, I'm a lot quicker than you are. You know, even with it the way that it is, there's still a wrinkle right here, right? Right? On the outside. But I'm betting money that there isn't any on the inside. Got it? Question?
Do architects ever cut a U shape or moon shape?
I have seen people cut and try to get rid of wrinkles. I have seen it. I do that with the removable ones. If I'm struggling, making them removable, this is not an easy one to make removable because it wants to slide down like I was telling you, and then you get this gap.
How could you even?
Oh, you can. I'll show you guys on Tuesday. I'll make one.
For them to be able to put it back on themselves.
It's tricky. It can be done though. All splints can be removable. Any questions so far? This one's so piece of cake, right?
Oh yeah.
Oh boy.
Right? Remember, it only gets harder. You think the little thumb and the fingers and all that shit? No. Much more difficult. You're crossing two big joints. Hopefully you don't do this one removable though, but some people do. See how the padding is way above where it needs to be? You can fold it all the way down. I can bend his fingers down. Now I can't control all of his range of motion, you know, his flexion extension. With a sugar tongue, you just can't do it. But you can control supination and pronation. Got it? Let's see what you guys make. You're on your own.